Hey, it's Wednesday. It's 8:36, and that means it's time to bring in our good friend Dr. Joe. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, with some insight into the world of sports medicine. And Dr. Joe, what do you have for us this morning?
Hey, Ray, you know what? You and I have been in a little bit of a rut lately, and we have been talking a lot about football, a little bit about quarterback play and other things and injuries. And I wanted to move to some other really hardworking fall athletes who are coming down the stretch of their playoffs right now, and get a look at our soccer players. I wanted to talk a little bit about soccer. And, you and I have also talked about positions that might be the most important in sport and how they have sometimes unique injuries. Quarterback's a little different than other football players, pretty important position. Pitchers in baseball. Some people say pitchers in softball might be the most important position that we have of any of our high school sports. But we have never, I don't believe, talked specifically about soccer goalies. And so like everything else, I go back to my office, and I've seen several soccer goalies with unique injuries, and they have a high injury rate. And I wanted to talk a little about soccer goalies today, Ray. Number one, they have unique, that they have a lot of hand and finger injuries. They get fractures and dislocations from trying to catch balls or knock down balls that are hit at them pretty hard. And when a soccer goalie gets injured pretty badly, we need to get them back out on the field. It really can change the trajectory of a team or how good a team is going to do if they lose their goalie. So hand injuries are unique. They get shoulder injuries, too, which I don't see as much in the soccer world other than in goalies. They separate their shoulder, dislocate their shoulder, and we try to get them into rehab to get them ready to get back because it's such an important position. But they also get ankle and knee sprains. They have to move and pivot quickly in the goal, and so they get traditional lower extremity injuries. And then, of course, somebody's going to ask me, what about concussions? I have to admit, in my study in the last day or so about soccer goalies, I was a little bit surprised myself. The concussion rate amongst goalies is not higher than other positions in the field of soccer. And other soccer positions are higher, but the injuries, the concussions or head injuries they get are oftentimes worse, or they're out for a longer period of time in the concussion protocol. And it's because usually their concussions are not so much from heading the ball, but from getting hit head to body, elbow, shoulder, knee to the head, or knocked down when they're jumping in the air and land on their head. And so they can be more significant injuries. And so we all know the skills of soccer goalies. They need to have a good set of hands to be a good goalie. They need to be able to change directions quickly. They need to have good jumping ability and quick first step. And, of course, really important mental toughness, because many times the games ride directly on their shoulders and comes down to goal play. And so goalies are a unique set of people. Now, a good friend of mine came up with a really nice site that he has on the Internet. Chris Katuris is a good friend. We train together. And he has a thing, if you're training young goalies, it's called Saving Soccer Goalkeepers from Injuries. And he has about 10 or 15 different things you can do while you're teaching goalies how to play that can reduce their injury rate. Now, he works in Orange County, California, and there are good athletes in Southern California. But let's face it, they're not as good as the athletes in Northeast Ohio, where we know we have the best athletes in the country. But we have great soccer players. They're gearing up to get going in the playoffs right now. Some of his prevention techniques is make sure you play with an age-appropriate ball. A lot of times people are playing with adult balls and younger kids, and the injury rate goes way up. Learn how to dive and roll at a young age. Dive and roll. It saves the shoulders a lot. If they dive and land directly on the point of their shoulder, they're going to get some of these shoulder injuries. So dive and roll is something that needs to be taught early on. And when they're doing off-season strengthening, they need to work on the stabilizers of the shoulder, and that's a very common physical therapy program or prevention program that soccer goalies should be doing. and limit the long kicks early in the season. That'll save the groin injuries and the hamstring injuries. And then finally, when it comes to concussion, they like to teach how to fist the ball or punch the ball out of the goal in traffic rather than catching the ball. With catching the ball in traffic, there's a lot more opportunity to get knocked down, to get hit in the head. They also really like their goalies to learn how to keep their hands and their elbows up. And when they are getting challenged, they like goalies to learn to knock the ball away with their feet rather than head first. So those are some of the things that Chris taught. He's got 20 or 30 different techniques that can help prevent injuries in goalies, and it's a good thing to look up online. Chris Couturis in Southern California, Orange County. And so as we head into the playoffs here, we're into the playoffs a bit, and the better teams are rising to the top. Usually the better teams are the teams with better goalies.
You know, Joe, I think you hit on something really interesting because sometimes I think goalies in soccer get that bad rap that they're just between the pipes, but you have to be a terrific athlete to go side to side with that burst, starting with your legs and then the stretch and the athleticism with your upper torso to be a successful goalie. So I think this stuff is spot on and really well done.
Yeah, all of our PTs and trainers talk about explosion training for goalies. Really important. You have to be explosive. You see that in some of the penalty kicks and any kicks in the goal. Explosion is a really important part of it. But it kind of makes sense to me about making sure that if you do dive, roll into it a little bit, kind of like we teach quarterbacks a little bit. Don't land directly on the point of the shoulder, and other good techniques that are out there to keep our goalies safe so they can keep out there and use all those great skills that you and I just talked about that make them such great athletes, and they really affect the game in a big way. So keep an eye on our soccer teams in the next few weeks as they'll be going down the tournament trail, as well as our other fall athletes.
All right. Really good information this morning, my friend Joe. Thank you so much. Always appreciate the time.